Okay, welcome. We are starting a media briefing. We're hoping to do these on a weekly basis, so we'll keep everyone posted as far as what the date and time will be. But for today, we'll just get started. Susana Cordova will be providing some updates from the district, and then we'll have a little bit of time for Q&A.
Great. So thanks, Winna, and thanks to everybody for joining us here today. As Winna mentioned, this is our first planned weekly media briefing to help you provide families with the latest information that we have here in DPS. We do want to just share that our school-based staff members will begin their 2 weeks of training in preparation for the new school week starting this coming Monday on August 10th. Most of our educators will be working remotely, but in some cases, teachers will be coming back into our buildings. If they come back into their buildings, primarily that will be to work inside their classrooms, retrieve belongings. Some teachers have requested to teach remotely from the building to be able to support access to the materials that are so critical for their students' success. We will be conducting all of our adult meetings virtually, so even if there are people inside the school building, all adult meetings will be conducted virtually. We will be making sure that we're following all of the health guidance and precautions that are going to be so critical to keep our staff safe and healthy. We're very focused on providing the best education that we can to our students and prioritizing everyone's health and safety. And as part of that, we're providing our building leaders and our educators with information that reinforces the critical health guidelines that we want to follow. And so we've called those the DPS 5, and they're the most important health protocols for all of our staff who will be in buildings, and we'll ask them to follow them at all times. So here are the DPS 5. First, complete your pre-work health screening anytime you come into the building. It's really important that we do that. We're asking all employees who enter a DPS building to complete a health screening every day, and we're recommending and requiring that if you're sick, stay home. Number 2, wear a mask or face covering. That's going to be required for all adults and all students when our students are back at all times, unless people are eating or if they're on a scheduled mask break outside of the building. We're going to ask people, number 3, to maintain social distance. We're going to ask everybody to make every effort, particularly adults, to keep 6 feet away from other adults. Number 4, meet virtually. So to maintain that safe social distance, we're requiring that employees conduct all adult meetings virtually and refrain from using communal spaces such as refrigerators, microwaves, faculty lounges, things like that. And the 5th one is to practice good hygiene. Cover sneezes, we call that a vampire sneeze or cough. Avoid touching your face, washing hands frequently, and using hand sanitizer. So again, the DPS 5, complete your pre-work health screening, wear a mask, maintain social distance, meet virtually, practice good hygiene. So we're really going to try to stress the DPS 5 for everybody. We want to make sure that we reinforce that. We'll have signage up in all of our buildings to remind everybody of the importance of that, and particularly making sure that we are doing all that we can to keep ourselves safe and to keep our colleagues safe. So those are the main updates that I wanted to share. We'd be happy to open it up to questions.
Okay, if you have any questions, go ahead and use the chat feature. And then just as a reminder, we are recording this, and so it will be available afterwards if you need a copy. So we do have a question in from Melanie at Shockbeat. She's wondering, what are we hearing from our families, and is there any data on how many are choosing remote versus the in-person option?
Yeah, thanks for the question. So we definitely are hearing from lots of different families, and part of what I will share is that I think that any opinion that you have heard, we have also heard. There's a wide spectrum of thoughts about returning to in-person instruction as well as remote. Probably the most important thing, we are hosting family focus groups to get input from families. Definitely families want to know what the plans are for in-person instruction and how to do it safely. We're working really hard on that. We have been collaborating with doctors from Denver Health and the Metro Denver Health Partnership on a framework that would look at multiple measures to safely use data to determine when we can resume in-person instruction. I think that probably is the thing that parents are most interested in is they want to know that their kids can be in school, but they want to know that it can be done safely. We are also hearing from parents, I think many of you know we do a Facebook Live show every day from 10 to 11. Many parents and educators participate in that. And many parents want to make sure that if they want the 100% virtual option, that that still is available to them. In terms of what we are hearing through annual family update, we have made the decision to say that the selection of 100% virtual or in-person is currently non-binding. So we want to give parents more time to make that decision. People are still completing annual family updates, so I don't have any new information about where we are currently with that.
Our next question, can we guarantee that all children will have a computer for remote learning, or will it be one per family?
Yeah, thank you. Really important question. Even in the spring, we made every effort to make sure that every student had their own computer. And so we do want to make sure that kids have their own computer for their coursework. If you've got multiple kids, it's really challenging to be able to engage if you don't have access to your own device. So we didn't collect devices. We did ask students to keep their devices over the summer. We did collect them from kids who are leaving DPS or from our graduating seniors. We will repurpose those, and we also are purchasing additional devices so that we can support students who might be new to the district if devices broke over the summer. I've shared with people the very first week we went into remote learning, I had my laptop in my bag and I spilled a full bottle of water on it. We know accidents happened. Fortunately, my computer worked, my camera didn't work for 3 weeks, it dried out, it worked again. So we get it, it happens. We have replacement devices for people.
We have another question. Understand COVID can be carried by people and remain on surfaces. The question is, how are the buildings tested? And if someone tests positive that was in that building, do you close that for cleaning?
Yeah, thank you. We are putting a lot of effort and energy into cleaning and sanitizing our buildings. We know how important that's going to be to safely resume having people working as well as having students in person. So all high touch areas will be cleaned multiple times throughout the day. We'll have hand sanitizer. We'll have scheduled time for hand washing. We will sanitize. We've purchased sanitizing wands that can sanitize a classroom in a very short period of time, I think under 3 minutes. We have purchased additional sanitizer for use with the wands to try to make sure that the environment is clean and safe. In the work that we're doing with our local health department, we will be following all of the requirements around quarantining. If a person is exposed to someone with a positive case outside of DPS, that person will need to be quarantined. And if we have any positive cases inside of DPS, either for our adults or our children, the people who are in close contact with that person, and the CDC defines close contact as 15 minutes of time within less than 6 feet, that entire group would need to go into quarantine. So we will be following that.
Great, a number of questions up. Let's start with can we talk about the groups of prioritized students for in-person learning, when they might go back to school, and how we would define those groups?
Yeah, thank you. We are still working on what plans for supporting a safe and gradual return to in-person would look like. And so we're working on that both with the doctors who are developing a framework to help us make determinations around what that looks like, as well as with our school leaders and our teachers. We want to make sure that we have leader voice, teacher voice at the table as we design a transition. So we don't have any firm plans yet. We do hope to be able to begin to bring students slowly back into our buildings, do so safely, make sure that we're all following those health protocols, and do so with the blessing of the health department around our plan.
My next question is it safe to say that DPS hasn't determined class sizes for in-person classes? And then also, if you could talk a little bit about training for teachers, what that will look like, and whether or not it will include instructions for how teachers can manage cohorts if and when in-person learning resumes.
Yeah, thank you. So we're working really closely to determine the size of a cohort, which is different than the size of a class. And so I'll describe a little bit of the difference. At elementary school, it's likely that your cohort would be your elementary school class. So that we would have a defined number of adults and students who would be able to interact with each other during the day. We're using both the CDE and CDPHE school reopening guidance, along with the guidance from our local health experts who will be working with us on our school-based plans. At secondary, a cohort might be a group of students who have one or two classes together. Most of our secondary schools are looking at block scheduling so that they can support really maintaining smaller groups of students so that we can ensure that if there is a case of COVID, if there is a positive case, that we're really minimizing the disruption or the impact within a school. We do know if somebody does have a positive case, that group, that cohort will need to go into quarantine, and we want to make sure that we're trying to minimize any disruptions. So we are finalizing those numbers. We can definitely follow up with that information in writing. I don't want to misspeak. There are a few differences between the elementary level and the secondary level. So I want to make sure we get that out to people accurately. It is likely that when we resume in-person instruction for our secondary schools, given the way secondary schedules work, that we will be considering a return in a hybrid setting. We're trying to make every effort for elementary to be able to have elementary school students in person every day by maintaining small groups through a homeroom structure. There was a question about training. Thank you. Let me make sure I answer that. So around training, our first area of emphasis with our teachers as we begin first quarter with virtual instruction is on high quality virtual programming. We have made many updates to what the virtual program will look like, and we think it's really important that we're supporting the integrity of high quality virtual instruction for all of our students. We're starting the year with personal connections for all of our students and their teachers. We've asked every student to have a personal contact with their homeroom teacher or a teacher from their building. We want to make sure that that is really about introductions, building relationship, checking in on kids. It's been a long time for some of our kids since they've been with a teacher. We want to make sure that we connect with parents so that we know the best times to share information. We did a lot of surveying and focus grouping with students, parents, and teachers from last spring and over the summer. And by far the people who experienced virtual learning in the most positive way had frequent touch points through video conferencing or telephone with their child's teacher. Students had more contact with teachers and parents had more contact with teachers. So we really want to stress the importance of building relationships for virtual learning to be successful. Classes will start on the 24th, and we are looking at having a lot more of a regular start to school in virtual learning with regularly scheduled live classes along with office hours, small group instruction, connections with parents. So the bulk of the focus with our teachers right now is on how to do that well, along with the health and safety protocols. As we think about looking at returning to in-person instruction, we'll definitely work on many of the protocols that we'll need to implement for health and safety.
We have another question. have we seen a decrease in enrollment, for example, people choosing to unenroll and homeschool, or choosing to redshirt kindergartners and wait until next year to begin schooling?
Yeah, thank you. I think it's a really important question. We've definitely had lots of conversations with parents who are thinking about supporting their kids at home, either they themselves or in small groups. And many of the conversations that principals are having with parents are how they can enroll in the 100% virtual program that we offer, stay connected to school, stay connected to their child's teacher, receive the supports from DPS curriculum, from what virtual instruction we will be offering to be able to do that, and to be able to stay connected to their children's friends, both if they are doing some sort of pod at home as well as their classmates virtually. And so we know that there definitely is a lot of conversation going on around that. I haven't heard yet about people considering waiting to enroll their youngest children, preschool or kindergarten. I'm sure that many people right now are weighing all of those choices. We would really like to encourage families to consider the 100% virtual option, even if they're thinking about having more supportive programs at home. It's a great way to make sure that your child gets access to our state required curriculum, the resources that DPS has to offer, the mental health supports that DPS has to offer. And we also are right now looking at how we might be able to provide space in our schools for learning centers in the event that parents really would like their children to be able to have a safe space to engage virtually with their classroom and their teacher, but from our buildings. I know Adams 12 is doing work on this. We've connected with them. We're also looking at how we might be able to offer that potentially even right after Labor Day.
Great. And our last question, we've received questions from teachers about how arts will be managed when students typically share those materials or instruments. Can you describe what the planning around those classes will look like for in-person and virtual?
Yeah, it's a great question. We definitely want to communicate to our entire community that we're going to continue with all of our electives that we currently offer. It will look different in a virtual environment, and when we're in person, it will still look different. So we are stressing that all students should have their own set of materials. We're actually working with our DPS Foundation to do fundraising and material drives. So in the event that families aren't able to secure the materials that their kids would need for virtual learning at home, that we can get those and pass those out to our students as well. We will stress that students should have their own set of supplies, including for things like art class. So we won't be using communal materials because we want to make sure that kids keep their materials to themselves. There's less transfer or spread of any potential. I think the reality is when we're able to be back in our schools are going to be cleaner and healthier than they've ever been before. We really are trying to emphasize the importance of new routines. It will be different for sure. There's a lot, I think, that when we think about this, that will feel very unusual. What we've seen in the summer programming that we ran in person is that kids are incredibly adaptable, and that with good modeling by adults, we can do this really successfully. So we're looking forward to getting the framework, being able to implement our DPS 5 and keep everybody healthy, and hopefully back in person as soon as possible.
All right, thank you. That wraps it up.
Great. Thanks, guys.